Hello and welcome to the Inner Voice Show, the show that's about you, about everything that matters to you in your life from a psychological perspective. I'm Dr. Foojan Zeine, and I'm so excited to have a wonderful and a beautiful guest today with me, Melody Moezzi. Let me tell you a little bit about Melody before I have her on. She's actually on Skype with me today. So Melody is a writer, she's an activist, she's an attorney, and an award-winning author. Her latest book is Haldol and Hyacinths, Sombol, Bipolar Life, and it was released by Penguin in 2013. Moezzi is also a United Nations global expert, an opinion leader for the British Council's Our Shared Future initiative, and she's a blogger for the Huffington Post and Mrs. Magazine, as well as a regular columnist. And a blogger for BP Magazine. Her writing has appeared in the New York Times, the Washington Post, the Guardian, and many, many other outlets. She lives in Northern California, not North Carolina, not California. I think this is, I know this is my wish, Melody, for you to be here in California, actually. And with her husband, Matthew, and their cats, Nazanin and Kishmish. Oh, how cute, Kishmish, that is adorable. Welcome, Melody, to my show.
Thanks so much for having me, Foojan.
It is so great to see you. I have met you a couple of times in the Women's Leadership Conference that we've had, and both of us were a speaker there. I read your book, and it's great to have you with me.
Oh, it's great to be here. Thank you so much. It was wonderful meeting you.
You have been an inspiration not only to me, but also to a lot of my clients, because your book is about bipolar. And I know that you have been diagnosed and have been managing your bipolar. And this book is also about that and your life and all of what you have gone through. And I have given your book to many of my clients who actually have gone through managing their life in that way. And many times during that time, they felt powerless and hopeless and not necessarily know that there is a light on the other side of the tunnel and around the tunnel, in a sense. Yeah. And it's been really an inspiration for all of them. Tell me about your book and tell me about why were you choosing to even write about it?
Well, you said what your patients felt like, and I felt the same way when I was first diagnosed. I felt very alone. I felt like this was a moral failing on my part as opposed to an illness. And I've had a serious physical illness before, and the experience was just so different. I had a pancreatic tumor that nearly killed me, and that experience, in terms of the support I got from my community, was so different because this new thing, this illness, was a secret, right? And if it's so bad that it has to be a secret, then of course somebody's going to be ashamed of it. And for me, writing the book was my way of, one, getting over that shame, and hopefully helping other people feel less alone, and getting rid of the stigma, which of course people say that a lot with mental health, stigma. But it's a nice way of saying discrimination, which people living with mental health conditions face every day. And we are not a small minority of people. About half of Americans in their lifetime will deal with some sort of mental health condition.
Absolutely.
Globally, it's the leading cause of disability around the world, for example, according to the World Health Organization, is depression. So obviously these illnesses are very disabling, but what I find more disabling is the stigma, is the discrimination that surrounds them.
Absolutely. Melody, you're right about the stigma. And I also know that I deal with a lot of the clients where their families and themselves are not only dealing with the management of the illness itself, but as you said, keeping it secret, having the shame, not knowing what to do with it. And because there's not a lot of information out there about how to manage, like you know how to manage heart problems, people know how to manage diabetes. They've really got to know how to manage physical illnesses. But when it comes to many of the mental illnesses, we don't have the pathways and how to handle many of these. It's just the only thing we say is, okay, they're going to be medicated and hopefully medical management supports. And what happens with the family system that are also part of the illness, and the illness also affects them, they really don't know what to do. Tell me, because I also know you're an activist, you've been around the world, so tell me, why do you think, in your experience of having physical illnesses at times and then having bipolar, how is this different as far as the stigma? Why is there a stigma from your perspective on bipolar versus any other physical illnesses?
Yeah, I think first we call these kinds of illnesses, it's such an important question. We call them mental illnesses. And in my speech, just in general, I do, and in my writing, I call it mental illness because that's what the world calls it. But the idea that we would not consider an illness of the brain physical is a problem.
Right.
The fact that we are not, the brain is in fact a very important part of the body. Without it, we can't really function. So the idea that we separate it into this separate category of illness that is, in Iranians as well, it's just a matter of like ruhi, like this kind of like, how are you feeling? It's not like a real solid illness that you can define. And part of it is psychiatry itself, which of course should be merged with neurology. If we understood more about these illnesses, it would, but we understand so little about them. And there's so many people who are trying to profit from the treatment, so it can get very confusing when, there are certain pharmaceuticals that have been very helpful to me, but so has diet and exercise and all those things that are important no matter what illness you have, if you have a chronic illness. But for some reason, it's a little harder when people are trying to say this is a real illness, which of course it is, for people to talk about diet and exercise. Well, it's an illness, you need medication. Well, you need all these other things for any other condition you have. Obviously, if it affects heart disease, it's also going to affect a mental illness. So I think we need a two-pronged approach. And we need an approach that also recognizes that certain people with certain psychiatric conditions are more prone toward faith, and the psychiatric establishment tends to see faith as a symptom or even a kind of superstition. They don't take it very seriously, and it can be symptomatic. There is such a thing as hyper-religiosity, but there is also such a thing as gaining strength from your faith. In a way that I certainly did. Prayer is a huge part of my treatment plan, for example, and that's not something that's necessarily really accepted, nor is the idea, especially in Western medicine, is it accepted that you could feasibly have a clinically psychotic experience that began and maybe overlapped a little with a genuinely mystical experience, no different than the kinds of things we read about when we read Hafiz and Maulana, right?
Right.
But that distinguishing it is hard because, if Maulana were alive now, for example, there's a big risk, all the spinning he did and the singing, he might be in a psychiatric hospital. So we have to pay attention to the fact that there are certain gifts that come with some of these illnesses, or at least correlate and correspond with them statistically even. There's actually data to show that we tend to be a little more creative. We tend to lean toward the more spiritual side of things, and that can get us in trouble. But I think it's also partly the way back to health too. And for me, it has been.
I also have sensed with many of the physical illnesses of the body, people have sort of an understanding about it that you're not the one who created it. The physical illness, it got created, and that that you don't have necessarily a control over it. Like you don't have control over your heart or your blood sugar or pancreas and organs. And for some odd reason, suddenly we have to have control over the organ of the brain. And I can see how that happens because obviously the field of psychiatry, the field of psychotherapy and psychology, sociology, and many of these fields have, even business, have this sense that you can change your thoughts, you can change your emotions, and based on those, if you can change your actions and all of that, and therefore, if you have an illness where the illness is creating a setup where you're not in control of your rumination, you're not in control of your thoughts at that moment or emotion, then it's seen upon as if it's your weakness that you're not doing it versus it's an organ that has some chemical shift at that moment, the same way any other organ of your body might have those chemical shifts. And not the same way you're going to manage diabetes and, heart problems and blood pressure, that you also can manage this, but not necessarily the same idea of control. What is your own experience as having this, and what's your experience as watching yourself and others go through this?
It's a hard diagnosis, and I think when I first got it, and I very much without realizing it shared that kind of mentality. Just get yourself together. Pull yourself together. You can do, and I've been able to accomplish a lot in my life with that attitude.
Yes.
But at a certain point, trying to just pull yourself together isn't something that can work when you're having. Particularly when you're having hallucinations and delusions. And for me, it got to the point, and that's where it had to get, unfortunately, for me to realize, oh, wow, I have an illness, for me to say, I have hallucinations and delusions. And that was my wake-up call. And unfortunately, had my wake-up call been many of the other symptoms, including a serious lack of sleep, including these deep depressions that were often followed by manias and vice versa. So if I had figured that out earlier, then I would have been diagnosed on the lower end of the bipolar spectrum with a less severe version of it. So I wish I had taken it seriously when it wasn't in that state, because once you reach a point where you're having hallucinations and delusions, that is now a possibility for you.
Right.
And for me, I don't even drink alcohol, let alone do drugs. So it was a very jarring experience to see things that weren't there, to hear things that weren't there, to believe so many things that weren't true when it happened. But thankfully, now that I know what this illness was, and at that time when I had my first and only manic episode to date, I did not know what I was dealing with. I had no idea what it was. You think, as well educated as I was, both my parents are physicians, I did not know this thing as bipolar disorder or manic depression, and I had not heard of it as anything but a pejorative.
Right.
I've heard of it when you're putting someone down, like, oh, she's so bipolar, or, I've heard of it that way and probably used it myself in that way. But I never heard of it as a genuine illness, and no psychiatrist ever tried to rule out mania for me, which I really encourage people, if they're getting a diagnosis, particularly depression, which is half of bipolar disorder. Bipolar disorder is often misdiagnosed as depression, and that's very dangerous because the medications for depression, when given in isolation, can exacerbate bipolar disorder, so that you're trying to treat the depression, but you end up pushing someone into a manic episode and making things even worse.
Right.
So it's important. I'm not a big fan of labels, and 20 years from now, I hope we call them something else. We'll have different labels for everything because we'll understand them better. But knowing your diagnosis determines certain things in terms of which treatments will and won't work for you and which treatments may be dangerous. It's important to know exactly what you have, since misdiagnosis is very much the rule and not the exception.
One of the things I'm hearing from you, which is very, very important, I'm hearing that knowing your illness and what you're going through is very important. Obviously, sometimes it has to happen by experience, and you have to first, you have symptomology. You go to the doctors. They first give you the diagnosis. Then you can go and study about the illness to get all of the knowledge that you can get from books, from articles, WebMD, whatever it is on the out there, your book, and then that way you get some information about experiences that other people have, and then you also have your personal experience that if you monitor these symptoms and you can see when is it that you are kind of going toward mania or coming down and going toward depression. I know that right now as I work with clients, the more that they get to know their stages, then before, as you say, for the mania to go in a space of delusions and hallucinations, they reach out to their physicians. They talk. They say what the experiences are, so that their physician, their psychiatrist, can manage their, with the medical management and the types of pharmaceutical, pills that works for them, and not letting them to go all the way to that extreme. Yeah. So that's the type of a management that really works with any of the illness, especially with this type of illness, because you're the one who's monitoring yourself internally. Not many, with all the illnesses, not many people from outside can really know what's going on inside of you. So the knowledge you acquire about yourself is important. Melody, one of the most amazing concepts about you and some others who have been suffering from this type of an illness is some people fold under it and kind of give up and go into the depression, not only from a chemical aspect of it, but also from a psychological place where they let go. And we've seen this also with other illnesses. Some people can be diagnosed with cancer and suddenly give up everything and said, that's it, I'm done. And some people fight for many years and they come through and, they succeed and all of that. And it's the same as you. You've gone through your ups and downs. However, you've managed to complete, your law school and law degree. You're an attorney. You're an activist. You're a writer, and you have family. So every aspect of your life, although you go back and forth, that you also create success. I remember the first time we met, and I asked you to be on my show. We scheduled it, and you had called me, I think, about a week before the show and said, Foojan, I'm not feeling very well, and I just need to, not be on the show right now, and then I'm going to go through my cycle, and then, meet you again and call you back. And I thought it was such a beautiful and a responsible way for you to take care of yourself. I want to know how, if you can share your experience, especially with our audience who might have someone or they're going through this, how do you keep yourself up in a way of managing the illness and creating success all the time?
Well, I think managing it is something constantly I have to be aware, right? And I've been lucky in that I can do most of my medication is preventative now, so that if I see myself becoming manic, I'm able to take an antipsychotic, for example. That has, now that I know I can do that, that's why I've never had another acute manic episode. It's been more than 7 years since that happened. I've only had that one, and I think that's why. But largely in terms of why, I'm not always successful for sure. Certainly not in my mind, but the things that I have achieved, I genuinely believe it's because I have had faith that God put me here to do something. And when he sent me a sign and said, go this way, go that way, I didn't push it. There's the greatest prayer that you can pray is that God does what he wants for you, not what you want for yourself. So when we say I genuinely believe that because it's been my experience, because I have wanted to go in one direction desperately and tried, and then God kept knocking and saying, this isn't it, this isn't where you need to be. And when I turned around, things got so much better. And I think that applies when you're dealing with illnesses or anything else in life. When I finished law school, I have a master's in public health as well. Like the obvious thing would be go practice as a public health lawyer, which I never did. I published my first book after law school. I did practice law for a little bit, but ultimately I do use my legal education and my public health education a lot in what I write and some of the things I do, my speaking, but it's not where I was supposed to be, but it takes a certain amount of faith, trust, courage, whatever you want to call it, to be able to see yourself going in one direction, see that there's a greater force that wants you to go another way, and surrender to that and accept that that force knows better than you. And I've done that consistently, and God has consistently put me in places better than I thought. And a lot of times what I thought was the worst thing to ever happen to me, getting sick, both with my pancreatic tumor and with the bipolar, good things came out of it. And there's a reason that happened. and I wouldn't change it because of that.
What I'm hearing from you is whenever you felt powerless at that moment about you've done everything impossible that you could do and be in control of, and that hasn't answered or it hasn't created the result you wanted.
Right.
What you did was surrender to a bigger concept of trusting yourself, trusting your faith, trusting God, trusting the process, that you will come through the other, in the other side and succeed in some form, although it might have not been to your timing or to your liking or whatever it was at that time. And that way of being, of surrendering, letting go, and allowing for things to happen, then it created the result. And when that result got created, and when you were in a space of managing and controlling whatever it was in your hand, you took off and you made the best of it again, and then you allowed it to go. So what I'm hearing from you is learning this dance between where is it that I'm in control and I can do something, so go ahead and do it, and where is it that I'm faced with some obstacle that I can't, and then let go and let God, or let go and trust that it all would work out.
Exactly, yeah.
You're also an activist. What got you to be an activist? And I know you have been an activist in areas such as Islamophobia, feminism, mental health, homophobia. And what does all of that have in common with each other? And what brought you into taking a stance for them, actually?
Yeah. So I've been an activist since I was a kid. I was 7 years old when I staged my first protest because the ice cream man wouldn't come to our neighborhood. So after that experience, I was sort of hooked. I started my high school's Amnesty International chapter, and after that, I decided that that's what I wanted to devote my life to, and that's why I went to law school, realizing pretty quickly that it's much harder to change the law than it is to change people's minds. So that's why I went into writing, because I thought that that was the best expression, the greatest expression of my activism. And I see it all as being very related, because I can't effectively sit and fight only for women's rights without fighting racism at the same time, for example, right? There are plenty of women of color around the world.
Right.
And you cannot fight one fight without fighting both of them. And you can't fight that fight without fighting homophobia, because wherever somebody is being discriminated against for a trivial reason like that isn't valid, I see it as being the same thing, no matter whether you're being discriminated against because of your race, your religion, your mental health status, whatever it is, it all strikes me as the same. And I was lucky in so much as I started off as an activist, because I saw very quickly that what was happening when people were telling me, this is a secret, be quiet about it, I had experienced that before as an activist. And I realized when people tell you to be quiet about something, it's because you have something important to say. So, and I also experienced that as a journalist, right? Often when people tell you to shut up, that's when you have the most important thing to say. And also that's the thing you need to say in order to grow as a person and heal. So that to me is part of my activism, my activism in and of itself is inseparable from who I am. It's pretty much why I do everything I do.
So you take a stand for yourself, you take a stand for who you are and your strength within yourself with the illness. You're taking a stand for every single human being out there to have the right to live, to have the right to be well. And when you see and sense that something is off, and that there's an unfairness, unequalness, and something is off, that you take a stand. Do you think that your own experience of having the stigma about bipolar, or feeling the type of a powerlessness that sometimes we feel against our own self, our body, and then the external world, has brought that fire, that passion to take control, to take a stand, to make it right?
That's something that's, I think, internal and I want to say in all of us. It's something that has, since I remember the moment I became an activist for real. And it wasn't the ice cream moment. It was during the war in the former Yugoslavia and in the Balkans. And during that time, I was in middle school. I was probably 12 or 13, and my dad had an issue of Time magazine, and on the cover there was a man who was emaciated, and it was one of the concentration camps. And I said, "Oh, is it like to my dad? I hadn't read it. I said, "Is it some sort of anniversary of the Holocaust?" And he said, "Oh no, this is happening right now." Oh. And the level of rage, just looking at the photograph, seeing how that was exactly the same photograph that I saw in my history books, and how it could happen again, while everyone's yelling "never again, never again," in this stupid way that's like, never again if it's only against our own people. Like, that's not how the never again works.
Right.
Never again works against anybody. Against anybody, because then they fall in that same group of people. And that's why it makes me so frustrated, and I work so much with LGBT Muslim issues, and getting the Muslim community to be more supportive of LGBT rights, because of the fact that we have no right to turn around and discriminate against anybody like that, and then even consider ourselves Muslim before doing that. Right. But then also expect them to come help in our fight against Islamophobia, because there are so many lessons that the LGBT movement has learned that they can help us with, in terms of the movement to fight Islamophobia that is becoming even more and more vital lately. So I think we have so many lessons we can learn from one another, and to close ourselves off is to not learn those lessons and to fight ineffectively, really ineffectively.
You have also said that you're an attorney who has bipolar. So what do you mean by that? What is the significance of being an attorney with a bipolar? Do you sense that, is it having the illness, or is it having the stigma that attaches itself when you are an attorney and out there doing something?
Yeah, so attorneys have a very high rate of depression and mental illness. And despite that, there's a huge stigma within the legal community that has really bothered me. And I am able to talk as openly as I do because I make a living by writing books. I don't think if I were making a living now actively practicing law, and I'm a lawyer in good standing, past the bar, all of that, but I don't actively practice. And I think being so open about this would jeopardize my career as an attorney. And I see a lot of attorneys for whom that has happened. It used to be that the American Bar Association and the National Conference of Bar Examiners actively discriminated against people with mental illnesses on their fitness applications in order to be fit to become a lawyer. A couple years ago, I wrote an op-ed for the New York Times about that very question that they asked. About whether you have a mental illness or have experienced, it's a very specific question that the ABA was telling people to ask, or telling different bar associations, state bar associations to ask. And that question was discriminatory, and it violated the Americans with Disabilities Act. Because you cannot legally discriminate against somebody on the basis of a diagnosis. You can you can discriminate on the basis of behavior. And that would have been easy. I mean, I had my fingerprints taken if I had committed a crime. There are valid reasons to discriminate and not allow somebody into the profession. But I don't think having a psychiatric condition is one of them. And because we have a rate of depression that is a rate of suicide that is the fourth highest of all professions, we need to start taking this seriously. And law students are killing themselves as well and not getting the help that they need because they're afraid of this question. And that they may have to answer the question. And technically, you have to answer it honestly, and if you don't, you're technically committing perjury. Right. And ultimately, that's what most lawyers with mental health issues do. They answer no to that question, and they commit perjury, which is telling that that's how they enter the legal profession, by perjuring themselves. That's not the kind of profession that we want to be. Right. And I think we can raise our profession by being better at this. And now, since I wrote that op-ed in the Times, the ABA has turned around its opinion. It's done a 180, and as has the National Conference of Bar Examiners. It took the Department of Justice pointing out the same thing that I wrote in the article, which was that they violated the ADA. But they have changed their recommendations, and state bar associations slowly are changing theirs as well, so that they are in line with the national.
Good for you. I'm so proud. Yeah, I'm so proud to have you take on such an important concept, because as I was hearing you, I know that a lot of times employers look at mental illness as a decision-making factor, but part of it has to do, especially with work that are not just labor-oriented and are decision-making and analysis, that there's an assumption that if someone has some sort of a mental illness, that they don't have the capability of appropriate mental analysis and capabilities, which is not the truth. That is not accurate.
Exactly.
So to put all of dysfunctionality can come up with any type of illness when it's at the peak of any type of illness. You may be dysfunctional, and that's why people go on disability with any type of physical illness or mental illness. But the point of taking one illness and just making it as a poster where whomever has this type of illnesses cannot function at all, it's not appropriate. It's not real. And that's what you were taking a stand for, is if someone is there with certain types of behaviors, regardless of the illness, that behavior can be called upon and said that's inappropriate. But to call that one illness is and basically what you were talking about, it was also coming to me of why this stigma is so high, because everybody feels that if they say it, they're going to be discriminated consistently. So they hide behind this concept, and when people hide, they don't educate other people. So your courage in the ability to be able to educate people is how things change, how laws change, how policies change for everyone.
Yeah.
So your experience.
Well, the other thing about hiding, I want to say, it's not just you get to educate. When you hide, you are not entitled to the accommodations that legally you should be entitled to having a disability, including a mental health condition, right?
Right.
You're entitled to certain, but if they don't know that you have the conditions, they're not, your employer, your university, they're not obligated to provide you the accommodations that might make it possible for you to be able to function, whereas otherwise you might not be able to do. And people don't realize that they are legally entitled to these accommodations. And they may be very small, but they make a world of difference. And it's not something you ask for. It's something you have to demand as your legal right.
Very true. For someone who, I have two-part question. One is for someone who's suffering from the mental illnesses, what would you suggest to them based on your own experience?
Who's suffering with a psychiatric condition in the moment?
Yes.
Yeah. Well, the things that have helped me most, obviously medication. When it comes to diseases like bipolar and schizophrenia, medication is definitely going to be part of your treatment. If you have a serious mental health condition, if severe depression as well, it should be part of your treatment, but it is not the treatment. There are other parts that you need to really consider. I mentioned diet and exercise, and we just say those, offhandedly, of course, diet and exercise, but that's huge. It's a huge part of my wellness plan. And my activism is actually a huge part of my wellness plan. Doing what I'm doing right now, and I'm grateful to you for giving me that opportunity, not just the first time, but also now after I called you and said, I am not feeling well, I don't think I'm up for it. And yet again, you said, but okay, let's get back together and do it. Not everyone would have done that. And I'm very grateful for that opportunity to be able to come back and be able to talk with your viewers, right? So that is, and being able to do that, being able to change minds, that makes me feel better. That makes me feel like I'm making some sort of a difference, and the weight is not so heavy of the illness itself.
Right. Part of my experience has been that people are not their illnesses. Maybe because I'm a psychotherapist and I work with this, with the people who are going through this. So this is not somebody's identity. This is not somebody's functionality and who
Absolutely.
they are. Everything has a cycle. So the element of the cycle is beautiful to go through. I've worked with a couple of people who've come to my show who have had bipolar, and I've witnessed people who are not managing their life appropriately. They just kind of act unprofessional because they're not managing their life, not because it's their illness. And that to me is the most important factor where I want people to really, really get this. It's not the illness, it's none of the illnesses, whether it's the physical body or the brain as a new organ or the mental illnesses. It's not the illness that does that. It's how you deal with it. You can use that to be unprofessional, or you can use it and still be professional. And that was my experience with you, was that you were managing being professional way before knowing that, the cycle of you going, you're up and down, and how you needed to take care of yourself. You called me way before, and I've had people who even called me 2 hours before that, or they tried, they really wanted to make sure that they could and they couldn't, and then the last minute they did. But to have that in mind, that nobody is their illnesses, and to know the person for who they are, and then respect any type of illness as they are, and to work with it. Going to the second part of that question, what would you suggest to the families of people who are going through psychiatric illnesses?
Number one, I would suggest that they take care of their own psychiatric health, especially moms.
Yes.
I very rarely do I have a public speaking engagement where there isn't a mother who is crying, handing me a book to sign, saying my adult son or daughter will not get help, refuses to believe this illness is a real illness. And so many horrible things that have happened in their family. And I've heard the story so many times over and over, and it just makes you wonder. Obviously, denial is part of these conditions. And it's really hard for some people to accept, but it's the way that society treats them as well. I think we don't really have a mental health, like a true mental health system in this country. We have a criminal justice system that is stepping in where we should have a mental health system, because right now in the U.S., our largest mental health facilities are jails and prisons.
Absolutely.
So the fact that we continue to effectively criminalize mental illness is yet another reason where people really get caught in a cycle. Because if you are in jail, for example, and then you have a criminal record, you might not even be able to find housing when you get out. You might not be able to find employment when you get out. And if the reason that you were there, these are nonviolent offenses that people are being locked up for, because we're criminalizing mental illness. And also, included in that, I say, because we're treating substance abuse as a criminal issue as opposed to a mental health issue. We have so many people in our jails and prisons, and there are people making a lot of money off of that. Otherwise, it wouldn't be happening. But more people have to stand up and say, this is unacceptable in the United States of America for this to happen. This is unacceptable anywhere.
Right. Absolutely. One of the things that came up for me as you were talking about medical management, and I wanted to get your experience, I know, for example, people who have anxiety disorders, they're more than happy to take and be compliant with anti-anxiety medications. Many people who have depression, they're more than happy to have compliance with their antidepressant medication. One of the illnesses that they're less compliance by the patients themselves is bipolar. And some of the people I've heard is because, in the stages that they're going up to the mania, they have such a good time that they feel like, this medication is just putting a damper on it, and they keep coming off of it. What would you say about that?
From my experience and the people who I talked to, the studies that I've read, and for me, my first manic experience, my first truly hypomanic experience was gorgeous and amazing. And I've had two mystical experiences to date. One was during a hypomanic episode, and one was during a manic episode. Yeah. So yes, it was beautiful and amazing. It's like nothing I could possibly imagine. I felt more connected to the rest of the world than I've ever felt. But that quickly went to the point of hallucinations and delusions, and it became scary and paranoia. And I think people need to realize that it may be beautiful and wonderful at the beginning. In your first episode, my first episode was completely harmless, pretty much harmless, other than the people who had to hear me talk constantly. But other than that, I didn't hurt myself. Nothing went wrong. But then my next episode was so much worse, and there was paranoia, and there were delusions, and there were hallucinations. So I think people romanticize something that may be their first experience of it that they will never get back. You're not going to have that first experience any more than you're going to be 22 again. You know, it's not going to happen. And who's to say it's not a combination of the fact that you were 22, you know? So I really don't think that that's something worth chasing. And P.S., the depression always comes, you know? So once people do things while manic that they really, really regret, and then if they become depressed afterwards, that makes the depression even worse. And I've seen it happen a lot because overspending, for example, is a serious symptom when it comes to bipolar disorder. And many people will go bankrupt.
That's true.
And I've seen that happen. And then they get the bills from everything they bought. And sometimes they don't even, if they were psychotic, they don't even remember all the things they bought. But next thing you know, within a couple weeks, they're bankrupt.
That's
you know,
true.
It's very, very scary, the things that can happen when you're manic. And I would never want to be fully manic again. I do understand there's levels at the bottom of mild hypomania that I honestly consider part of my personality, and I take it, and it's like that's in as much as this illness is a curse. I think we're lying to everyone if we say there isn't part of it that is kind of extraordinary, right?
Yes. It's one of the illnesses that does have that sort of a creativity that comes with it, the connection that comes with it, which many other illnesses don't have that blissful concept with it. That's very true. Right. Tell us a little bit about your book before we end the show. I really want the audience to get a glimpse of your book, and where is it that they can get your book?
Thank you so much. My book is Haldol and Hyacinths, A Bipolar Life. So it is the first Iranian-American bipolar memoir available. The first Muslim-American bipolar memoir. It's just basically not just the story of my illness. Like, as you were saying before, you are not your illness. And I couldn't write a book just about my illness, and I wouldn't want to. It would be really boring. But it's a book about my life thus far, including my struggles with bipolar disorder, which when I was first diagnosed, it really seemed like a metaphor. And any Iranian American, I think, can see the obvious, as a writer, it's a brilliant metaphor, right? You're two sides being bipolar culturally versus being bipolar clinically. Right. And for me, I'd always felt bipolar culturally. Right. And so it seemed like duh when I found out what it really was. Of course, that's what it is, you know. But that's largely, the book is about my experiences living with bipolar disorder and as an Iranian American growing up in the U.S.
Wonderful.
Feeling like I don't belong here.
So they can get your book from Amazon.com. They can go to your website, Melody Moezzi. Is it melodymoezzi.com?
Yes, it is, and it's available where books are sold, so at Amazon. But I encourage you, if you can, go to your local independent bookstore and get it, because it is the independent bookstores that really support authors in a way that the huge corporations do not.
That's beautiful.
If you can.
Thank you so much, Melody, for for being with me on my show. And it was a beautiful talk. I learned a lot from you, and I'm sure that our audience also learned a lot.
Thank you so much, Foojan Zeine.
And for all of you who are with us, thank you for being with us. I hope that you enjoyed Melody's experience and what she had let you know. You can go to her website or Amazon or any of the independent bookstores and have her book, Haldol and Hyacinths. And I keep saying that wrong, but you know what I mean. Sombol.
You're not the only one. Haldol and Sombol.
Haldol and Sombol. Thank you so much for being with us. Until next week. Bye-bye.